Hey everyone, Dr. Cummins here. I want to quickly walk through a few key updates to our trauma activation criteria. Now I know nothing gets the team more fired up than a policy change or memo, so let's try to contain ourselves, okay? We're professionals. First, the biggest change is around closed head injuries. So trauma yellows should now be activated for closed head injuries with evidence of trauma above the clavicles in the following patients. So they need to have one, be on blood thinners or anticoagulation. Two, they have to have deviation from their baseline mentation. Three, they need to have a loss of consciousness after the head strike of any duration. It can be brief. And then four, they need to have more than one episode of vomiting or report a very severe headache. Okay, so a patient who comes in who's 75 years old, who's on Eliquis, who fell earlier that morning and hit their head, but has no signs of trauma above the clavicles, they do not trigger a trauma yellow anymore, okay? Now going to the trauma red side, we have a new GCS cutoff. It's now less than 9, okay? The old language said less than 8, which technically excluded a GCS of 8, so that's been corrected, okay? The other thing we've cleaned up is our vehicle criteria. Okay, so motor vehicle collisions no longer trigger a trauma yellow just because they happened or they happened at a certain speed. Okay, what matters is the risk of an exam finding. So it needs to be a motor vehicle collision with seatbelt bruising or abrasion to the neck, chest, abdomen. That's trauma yellow criteria. Okay. Also, for death in the same vehicle and a rollover MVC, these are no longer automatic activations of red or yellow in an otherwise asymptomatic patient with no concerning exam findings, okay? So, but that said, you should strongly consider a trauma yellow based on that mechanism and the patient factors, whatever symptoms they're complaining with, and your bedside concern, okay? Now, also we looked at motorcycle, electric bike, and electric scooter crashes. Those now are anything over 20 miles per hour are explicitly listed as trauma yellow criteria, okay? Now the layout has been a little bit reorganized with the most common trauma presentations at the top and less common items are down below. The trauma red now follows more of an ATLS primary survey structure with airway traumas, breathing trauma, circulation, and neuro following it. Kind of how we think at the bedside anyways. So these changes, they're gonna go into effect later this week, probably May 15th. Big thanks to Kirk Mills for putting this all together. And as always, remember, your clinical judgment is built into these, okay? This is here to support, but not replace physician and nursing discretion, okay? If it feels like a trauma activation, trust your gut and activate the trauma. Stay sharp out there. If you have any questions, find me or Kirk in the department or send us a message.